Evidence points to a widespread increase in alcohol, domestic, and substance abuse, in addition to a rise in mental health issues during the global pandemic. Healthcare workers have not been immune to these pressures, with unmitigated stressors, fears, and challenges putting frontline workers at risk for suicide, PTSD, and other health issues. Physicians often heal others while risking their own health. Not only do 51% of United States physicians face burnout, a rate which is 15 times higher than that of other professionals, but many physicians think the answer lies in numbing themselves to the pressure instead of lowering it, creating an environment ripe for burnout and increased stress. Early in the 20th century, Dr. Hans Selye studied, defined, and tested the boundaries of stress, and his conclusions were simple. A variety of different stressors inflicted on the human body result in similar symptoms, such as fatigue, nervousness, and lack of focus. As these stressors continually afflict the body and its biological resistance, eventually giving way to exhaustion and further complications, such as heart disease and hypertension. Aside from its mental and physical toll on individuals, stress has a financial cost as well. U.S. businesses spend $300 billion annually on stress-related absenteeism, employee turnover, and diminished productivity. In a 2016 study conducted by the Harvard T.H. Chan School of Public Health, they found that 43% of U.S. workers reported they believed their health to be threatened by stress. The study also found a 53% higher incidence of stress among healthcare workers. In the next decade, cardiovascular disease, or CVD, in individuals aged 20 and older is projected to rise above 40%, with medical costs expected to rise above $800 billion, due in part to an independent causal association between depression, social isolation, lack of social support, and the causes of coronary heart disease. In addition, work stress has been associated with the 7 cardiovascular disease risk factors, such as smoking, obesity, low physical activity, poor diet, diabetes, high cholesterol, and high blood pressure. Work stress is created and integrated by employees at all levels of an organization. However, studies have found leaders can improve or worsen stress based on their involvement. Consider the following strategies when looking to reduce your stress or that of your team. Restrict patient accessibility. Focus on the quality of care you are providing and not the quantity. Take a vacation. Completely unplug and show by example how valuable time away is to preserving your family, community, and personal connections. Track your stressors and your behavioral responses by journaling for a week or two. Uncovering patterns and reactions can help you navigate and avoid stressful situations. Develop healthy responses. Instead of fighting stress with junk food or alcohol, choose exercise, enjoy a hobby, or engage in your favorite activities with family and friends. Build good sleep habits into your nightly routine. Establish firm boundaries by taking frequent breaks and set aside at least 11 hours between workdays to unplug and establish a work-life balance. Learn stress-relieving techniques such as meditation, deep breathing exercises, and mindfulness. Enjoy time with your friends, family, or community group. And keep your workspace tidy, both personally and departmentally, and add flexibility into your schedule. Remember the in-flight warning to first place your mask on yourself in the case of an emergency and then help small children or others in need? The same principle applies to the health of our industry's leaders. You must first care for yourself before you can help others.